Okay, hello everyone. Welcome to our event. My name is Afsa Hussain. I am a senior studying human health on the PreMed track. I am a peer mentor along with a lot of our students here. This event is held by the Emory Pre-Health Advising's Apply Committee. This is an event showcasing a lot of really talented health professional students. So we have a variety of like medical students, dental students, etc. And they're going to tell us a little bit about their journeys into the healthcare field and tell us more about what advice and guidance they have and what's helping them on their journey to medicine. Next slide. So just a brief event outline. We're first going to go over introductions and then talk a little about the process of preparing for applying through undergrad, the admissions process, when it comes down to school selection, and the current experiences of our panelists. So first, I'm going to have all of our panelists introduce themselves. Can you tell me your name and your whatever school you're going to, what year you're in, what degree, and anything else you would like to share with us. You feel free to tell us about what entrance exam you had to take to get into your school, and just describe your journey and timeline and where you are now. First on my screen comes Alex Condra. Could you go?
Sure. Hi, everyone. My name's Alex. I am a second-year MD and PH candidate at East Tennessee State University, Quillen College of Medicine. I graduated from Emory in 2020. Let me restart. So I'm from Chattanooga, Tennessee, originally, and grew up there, did high school there, whatnot. Came to Emory in fall of 2016 and started there. Originally was also considering nursing with PreMed. Did shadowing, did research, did the whole shebang, and decided I wanted to do medical school. So I took the MCAT on June 1st of 2019. So it was June 1st, right after my junior year. Took the MCAT, applied to medical school, did the composite letter process, which I'm sure we'll probably, if you all have questions, we can go more into that in a bit. But just to be brief, applied to medical school, started straight out from undergrad, so I didn't take any gap years. And here I am now. So yeah, doing the dual degree thing. I'm also in a rural primary care track program here. So like, for example, today I was in Rogersville, Tennessee, really small rural area, and I get to do some hands-on stuff, physicals, writing notes as a second year, which is a lot of like really unique, good early hands-on experience. So if you all have any questions about anything like that or special programs in medical school, feel free to let me know.
Okay, thank you. Anira.
Hey y'all, my name is Anira. You can also just call me Ani. I'm from Little Rock, Arkansas originally. I graduated from Emory in 2020, just like Alex. Majored in neuroscience, behavioral biology. I guess I forgot to tell what school I go to. I go to dental school at Columbia, and yeah, I mean, just started. So I guess like let me see. I going into college, I kind of was leaning towards dentistry, so I was like kind of aiming for that path already. And then the test that we got to take was the DAT. So I took that in my junior year, in the middle of junior year, during my winter break. So I think it was like sometime in January 2019, I think. And then yeah, I did. I mean, Alex kind of went over a little bit, but do the composite letter recs, et cetera, and applied, and started Columbia last August. And right now I'm not on any other special track, but I mean, we'll see. I mean, that comes, I think for us, that comes later on if we want to do that or not. But yeah, that's pretty much it.
Thank you. Can we get Letha Khan?
Hi guys, I'm Letha. I graduated from Emory in 2019, and then I actually did my first 2 years at Oxford in 2017. And then let's see here. So from there, I went to VCOM in Auburn, which is the DO school in Auburn, Alabama. So I guess I'm a War Eagle football person now, which is weird coming from Emory, because we didn't do all of that. So I learned what football was. I'm originally from Huntsville, Alabama, so it made sense for me to go home, and that's kind of what I wanted. As far as DO school goes, it's kind of, I mean, it's a medical school. We learn a lot about osteopathic medicine, which is more like hands-on, more manipulations. Like earlier today, I was actually popping someone's back, which is kind of cool, and helping with like spinal alignment. So if anyone likes that, that's kind of fun. And I guess as far as like the track to get into DO school, I took my MCAT twice, actually. I'm a horrible test taker. And during my junior year, applied and basically like got in, went straight through, didn't take any time off. And yeah, I love being at VCOM. So I was in Auburn, Alabama for 2 years, and I'm in my third year now, and I just moved back to Huntsville for my rotations. And so that's like, I think it was Alex who was also saying East Tennessee does rural medicine. A lot of DO schools also do a lot of rural medicine, and they actually like will send us out to different sites for our third and fourth year, and so you just move. So I've moved every 2 years now. So if you don't know where you want to be, definitely something to look into. I guess, yeah, I can't remember what else I forgot, but if you have any questions, just let me know.
Thank you. Sherman?
Hello, everyone. My name is Sherman Jones. I'm originally from New Orleans, Louisiana. I did my undergrad at the University of Mississippi, where I majored in chemical engineering, minored in sociology, math, and neuroscience. And then I went straight through to start medical school at Emory University, where I finished 2 years of medical school. And now I'm in my second year of the PhD program at Georgia Tech, studying biomedical engineering. And again, if you have any questions, feel free to ask. I'll be here.
Okay, thank you. Amanda?
Cool. Hi, thank you all for hosting this event. This is so cool. My name is Amanda. I'm currently a third-year medical student at the Medical College of Georgia at Augusta University. I went to Emory, where I graduated in 2019. I double majored in biology and music performance. I was always really interested in medicine, but I'm also really passionate about bringing the humanities into medicine. So one of the things that drew me to MCG was the ability to do a bioethics certificate, and so I'm doing that as well. A little bit about my journey. So I did matriculate to MCG immediately after Emory. And so I ended up taking the MCAT during January of my junior year. I went through the composite letter process starting as early as March as my junior year. Ended up getting some interviews between September and January of my senior year, and then matriculated in August. And I've been really happy with my decision. Kind of similar to, as mentioned by some other panelists, MCG offers the opportunity to travel when you're doing your clerkships. So right now I'm in the middle of my third year. I'm not in Augusta, Georgia. I'm in Brunswick, Georgia, and I'm on my general surgery rotation. So that's a little bit about me. Feel free to ask any questions.
Awesome, thank you. Sonam?
Hi, everyone. My name is Sonam. I graduated from Emory in 2018. It feels like forever ago, but it's actually not. I also majored in MDMBA. It's exciting to see so many people who majored in neuroscience there. I actually wear Emory gear so much here that someone made me a t-shirt of the UNC motto hitting the Emory motto on the head, because I still rock gear at UNC. So very loyal to Emory and loved it there. I took 2 gap years and worked for AmeriCorps, did scribing. I scribed for Yale for a bit. and did some other fun things like backpacked Europe. And I'm a huge pro of gap years, so happy to talk more about that as well. So now I'm an MDMBA candidate here, currently in my second year and about to take a step in January. And yeah, so happy to talk about any of those things, about dual degree programs, gap years, how to prep while I was at Emory. I knew I wanted to take a gap year pretty early, so I took my MCAT as soon as I graduated. Not super fun given I did a thesis too. So it was like, but I feel like I wanted it to rain and pour at the same time and then me relax. So that's kind of when I took the test. And yeah, happy to answer any questions anyone has.
Awesome, thank you. And Jennifer, Min?
Hey everyone, my name is Jennifer. I graduated from Emory in 2018, like Sonam. I majored in biology and political science, and I came straight to medical school over here in Dallas at UT Southwestern. I am currently a fourth year medical student. I am an MD MPH student. I finished my MPH last year. And I'm applying into anesthesia residency. So feel free to ask me about anything related to medical school or anesthesia or Texas, if any of y'all haven't been and are trying to apply to Texas programs. But maybe some of the earlier stuff I may not remember, like MCAT.
Okay, awesome, thank you. So we're gonna dive right in. And also, if anyone comes up with any questions that you want to ask, whether specifically or to all of the panelists, you can put it in the chat. And these questions, we do have a lot of amazing panelists, and so if we don't have to go around and everyone doesn't have to answer all the questions, but if a question really speaks to you, if you have an answer you want to give, please do feel free to answer. But the first question we wanted to ask was what made you want to pursue this path, especially for those of you who are doing a dual degree. What brought you to wanting to apply to that path, and have you ever doubted your choices, and what ultimately made you decide to stick with it? And anyone who wants to answer can go ahead.
I don't mind starting. So I'm in the MD PhD program between Emory and Georgia Tech, just as a reminder. And for me, I think it was once I kind of had this idea, oh, maybe I want to go into medicine, I immediately started thinking about research. And then I did some Googling and was like, oh, there's this thing called MD PhD program. And although the actual story is a lot more complicated, it basically distills down to, okay, this is something that seems cool. I kind of want to try, see what happens. Looked at the different requirements for it, tried to get involved in research early, tried to get involved in volunteer work early, and then just kind of did my best. And eventually I got in, which was really awesome. There were lots of doubts throughout the entire process. Oh, I don't know if I'm smart enough. Oh, I don't know if I'm applying to the right schools because they were so competitive. I don't know if I'll be a good doctor. There was just a lot of that kind of struggle. And then now that I'm getting about halfway through my program, a few of my friends who started with me are now graduating. So I'm like, oh, great. And there's actually one girl that I know who I was her mentor when she was a sophomore in undergrad. And she just started medical school, and she's going to finish a year before me. So I try not to think about that too much, but ultimately, I think the kind of career I want to have, which is being a researcher in biomedical engineering and being a clinician, I think it's worth the effort and the time.
I'll take a stab at this question. So I was always kind of interested in medicine, but some things that really spoke to me about an MD career was one, helping people, which I think is something a lot of people in healthcare professions have in common. And two is teaching and mentorship. I think that there's a lot of value in being able to teach as a physician. And those were things that really drew me towards medicine. Not that I've ever doubted my career choices, but there were definitely some very stressful times along the way. The first one that stands out to me is right after you submit your application and you're waiting for interviews and then you're preparing for interviews. I think that was a very stressful time. But something that really helped me get through it was just the mentorship that I had. I really relied on the people who went ahead of me, and that's kind of why I'm passionate about mentorship too. So if y'all have any questions about that, feel free to reach out. And then the next most stressful part so far for me was the transition from the second year of medical school to the third year. You go from learning in a classroom all the time to now you have to learn in the clinic, and then you have to go home and study. And it's just a very big learning curve. That being said, it's definitely manageable. And one of the best things about medical school is the camaraderie. For all y'all at Emory, obviously, you know that, you're very lucky to have such a caring community. And I found the same thing in medical school too. So definitely rely on your peers, and it helps make the stressful times less stressful. So that's my advice.
What about Letha? Could you tell us a little more about like what made you want to go into DO program and why you really enjoy it, I'm assuming?
Yeah. No, I really like it. So the idea behind DO medicine, there's like all these tenets, and something that I can go into or we can Google kind of for time's sake. But really what osteopathic medicine focuses on is this whole idea of holistic medicine, the mind, body, the spirit. And to me, that's always confusing because it just seems as if everyone should be practicing that way. And it seems as everyone is practicing that way. So that part of it is the spiel, but I just don't understand it. For me, it's more of the osteopathic manipulative. Yes, that book that you're holding up there. Sherman, I think, is holding that up. For me, it's more of the actual manipulative techniques. I'm a very hands-on, I'm a kinesthetic learner. And so for me, osteopathic medicine was cool because I get to learn the skill that I can apply and help my patients with. I was actually in a pediatrics clinic about a month ago, and we actually had a person come in with like a really tight IT band from running and playing softball that was really killing her. And right there and then I was able to help her. Like I didn't have to wait. I didn't have to tell her to just like ice it and stuff like that. And I was able to show her mom like how you can help with these different tender points, these trigger points, these tightnesses in the muscles. And it's something that it can help. I mean, this person came in in so much pain and was able to walk out feeling better. And it took me about 5 minutes. And I think that knowledge base has been so good. And I really enjoy that. I've been drawn to it. When I was in middle school, I think, or high school, I did one of those like summer pre-med programs kind of things. I can't remember what it was called. But I remember we toured an osteopathic school and I thought it was so cool because I had a headache that day and they have this maneuver called like the suboccipital release in fancy terms that actually like will help with your headaches. And I do that. My friends and I all do that on each other's. We literally talk about how we don't use ibuprofen anymore. And so for me, it was learning little tricks like that that I really appreciated. And I know I can help my patients with one day. I doubt my choice. Studying for STEP and COMLEX, yes, you have to take 2 board exams, or like I did. Now it's changing. There's a lot of logistical things that are making it to where not everyone has to take 2 exams. But yeah, those 3 months that I was studying for 2 board exams, I questioned myself every single day, especially when I would get on social media and see my friends who weren't in medical school having fun. And here I am dying slowly on the inside. But other than that, it's fine. It's worth it at the end of the day. I think coming out into 3rd year, like Amanda said, it's a learning curve, but it's a learning curve that's, if you have the passion for it, it's so much fun because you're actually getting to see people change and actually be able to do things that make people happy. And so I think, yes, it's hard, but if you do have the passion for it, it really doesn't feel as daunting as I think it could feel. And so, yeah, if anyone has any questions about osteopathic medicine, can definitely help you out there. Maybe even virtually teach you how to do some of this stuff because it's really cool. I like it a lot.
Thank you. That sounds so awesome. And does anyone else want to share or answer this question?
I can share a brief tidbit about maybe why I went like the MD-MBA route.
Yeah.
So when I was scribing, the doctor I was working with at Yale had an MD-MBA, and the way this kind of worked is that it was actually like I was like her virtual scribe. So she would take a phone into the room and I would hear like the whole conversation and type up her notes. So I was only listening and I wouldn't get distracted by like actually being in the room with the patient. So I took in a lot of like how she conversed with the patient. Since it was only like one sense I was working with. And she did a lot of like counseling on jumping through loopholes with medications and insurance to help patients. And I found that to be really fascinating because my dream is to start like a rural clinic. My grandpa had a rural clinic for years in a small town in South Carolina, and he used to treat people for free. And ever since I was 3, he would take me with him in the days where there was no HIPAA and you could take kids into the exam room. And I have been inspired since. And so I kind of like knew I've wanted to do medicine for a while, but then I had this kind of realization in my gap years that in order to learn those loopholes, UNC has a healthcare specific MBA. So I'm not getting an MBA like someone who majored in economics would be getting. It's very focused on like healthcare insurance and medical malpractice and billing and how to save patients money. And that's kind of a main reason why I chose UNC at the very end, was because I thought this would be a good like deviation from like studying medicine every day. And like what a lot of people said on here is that having a break from looking at medical stuff is really nice, whether that's like taking care of your plants or like getting another degree. It's like I think they're both equally important to like train your brain to think about multiple things at once. So that's why I went that route, and I haven't formally started the program yet, but I plan to definitely enter it in the next year after I take step 2, actually. So that's kind of the background on why I chose that dual degree program.
So thank you. I was really curious about that too. So thank you for sharing. Would anyone else like to share, or should we just go on to the next question?
I can talk quickly about, just real quick about the dual MD and PH. So like I said, I actually put it in the chat because I forgot to say it, but I was a sociology minor in undergrad. And so far in medical school, and just even, you know, when I had before medical school, my interest in medicine, I was always really curious about how to treat communities versus treating individuals, and just kind of how so much of like the social determinants of health really do impact your individual patient, and how it's impacting so many individual patients, and that there's so often there's a larger problem that you can kind of combat to deal with issues like diabetes or, you know, hypertension. And so it's often there are like structural things in communities that you can kind of target and implement interventions with to treat more than just one person at once. And so I thought by doing the MPH, and I'm doing the community health concentration at MPH, I could really learn about how to better care for my patients overall, instead of just each individual patient come in and I prescribe a medicine and I send them on their way. And so I hope to implement that into medical healthcare policy in the far future. But that was kind of what drove me to choose the dual degree. Do I ever doubt my choices? Yes, because just like someone said, when you're on social media and you see your friends doing something fun, well, at the same time, sometimes when you're doing a dual degree, you push off MPH work until after an MD exam, and my friends will be out going, you know, to enjoy their evening after an exam, but I have to do a paper for my MPH, or I have to do an assignment or a project. But ultimately, I do think it's worth it, because I think that every healthcare provider should have some basis of knowledge about public health going into the healthcare field. I think that's super important. So I think it's a great thing. If you have any questions about it, a bunch of the panelists just put their emails in the chat, so feel free to reach out to any of us about any of those dual degrees if you are thinking about pursuing them.
Awesome, thank you. Okay, we're gonna move on to the next question. Arpita?
Yeah, so I know a lot of you panelists already kind of mentioned this a little bit, like when you took your MCAT, if you did. But what's the timeline kind of look like? We had some students who are interested in knowing about the timeline, and then especially like the admissions process and what interviews are going to look like in the next few years.
I can kind of talk about that real quickly, because I recently applied and I'm on our admissions committee here. So I've kind of seen some of this end of the admissions process also. But so starting out, you know, you're doing your basic sciences and you start like planning for the MCAT. One thing I do want to emphasize is that the PHA office does a really good job of keeping you on a certain track of when you should have your committee letter stuff done, when you should be planning to take the MCAT, and when you should be doing it for a smooth process to matriculate, you know, straight out, or even if you're taking a gap year, they set up really good timelines for that as well. So be in touch with your PHA office. To also kind of regress on that point, I wanted to tell you all that I did it really in a chaotic way, in a way you should not do. But all that being said, you know, I was told by multiple advisors, like, do not take your MCAT past March or April. Like, do not take your MCAT past March or April. Like, that is the time, like, that is pretty basically your deadline to do it, or you're looking at a gap year. And I do want to emphasize, like, you can take it after that. It's a personal decision. Like, you have to be certain about your letters of rec. You have to be certain about your personal statement being done. Like, you have to be on top of that yourself. If you somehow get into this rut with studying and you end up having to push it back till June, like June 1st is when I took it, and you know, I didn't take a gap year. I think it's so important to emphasize, like, it is possible to like get into MDs and get interviews. I had interviews and like it worked out. Like I said, it is more stressful, unnecessary even. But I think a lot of classmates of mine thought they were forced into a gap year because they didn't have their MCAT done by a certain time. And I do want to emphasize, like, that is possible to take it later. However, you should follow those guidelines because it will be less stress inducing in the long run. So you study for the MCAT. I think most people look at, I think a good number is like 3 months of studying. I think a lot of people, from what I've heard, a lot of people stick to that 3 months of consistent study time to be adequately prepared. And then, you know, you do your committee letter starting in March. You start submitting those materials and getting all of that done. I think the application opens May 1st of the year that you're looking at, the year prior to your matriculation. If you want to apply for 2020 matriculation, May 1st, 2019 is when that application first opens up. And from there, it's really, the ball does not stop rolling. You're submitting, getting it verified. You start getting secondary applications from the schools that you're applying to in, I think, July. I think around July is when you really start seeing like secondary applications come in. Some people choose to look on websites and pre-write their secondaries to get ahead. You can go on Student Doctor Forum, you can go on Reddit, and you can find some old questions that schools traditionally ask on their secondaries, and you can pre-write those. I did not. I just waited until I got them and I wrote them. It's completely up to you. People do both. It works out. I mean, it can work out either way. It's just about how prepared or ahead you want to be. And then you wait. And some people wait longer than others, and some people wait a few weeks and they hear back about an interview. And you kind of really just have to, someone mentioned this, and you really do have to have a support system of people that you can, know that, I think one group of people has to be a group of people that you're not going to talk about it with at all. You know, you have your friends that you're not going to talk about medical school with, you're not going to talk about interviews with. They're going to be like your distraction. For me personally, I had to have a group also that I could vent to about it. Often that was not other people who were applying at the same time. And I think it's really easy to get caught in this kind of, and I don't want to say it's a competition, but it's like so-and-so has an interview in October. I've heard from no one. And you just really get to where you're beating yourself up. I know someone in my class from Emory who had one interview in January and got off the wait list May 28th, like to that one school, and got in. Like, it's a different path for everybody. Some people will have 7+ interviews. That's just what comes with going to a school where people are really prepared and doing well in their classes. Like, you might be someone who's going to get 7+, you might be somebody who's going to get one interview, but like at the end of the day, you both can end up in medical school, and you just have to keep reminding yourself of that. I think my first interview was November, my last one was in April. So like, I literally had one at the beginning of April, that first week during COVID on Zoom. So you just kind of, it's a waiting game, and you just have to be comfortable knowing like anything can happen at any time from literally August, September up until April. So overall, I think, and sorry, I'm being long-winded, but I'm trying to go through the whole thing, but overall, be comfortable waiting. Know that anything can happen. Wait lists are so fluctuating, especially second semester. And definitely do not underestimate the interviews. You can have a 520 MCAT and a 4.0 GPA, and if schools can't talk to you as a person, and if you can't have a conversation, they're not going to really, a lot of schools won't see a reason to admit you. So do not underestimate the interview, and prepare for those as much as you can. That's my spiel for the most part. So yeah.
I can go next because I got 3 minors. I ended up doing my program over 5 years. And again, I went to the University of Mississippi. So I'm not quite sure how Emory PreMed works, but it sounds like you'll have a very good PreMed office. So with that being said, I took all the courses I needed to take for the MCAT first, and I took the MCAT pretty much right after that. I heard the advice to do 3 months. I did not do that. I did like 3 weeks, and they were awful. So please make time to study for it. And can I share my? Do you mind if I share my screen for a moment? Okay, I'm gonna hopefully have this work. But to kind of make up for that, I end up becoming very neurotic when I was actually applying for medical school. So I made like literally a list of every school I wanted to apply to, like all the information I can get, because I knew that if I started getting getting interviews and applications, that was going to happen during my 5th year of undergrad, and that was going to be the hardest semester. So I had to like stay on top of things, because I knew the ball was going to keep rolling, and I would not make it. You do not have to be this neurotic, but I just want to show y'all like, here's just general information, here's like how I'm organizing, who told me what, if I got an interview where, waitlist accepted, and like anything else I could find. How Alex had mentioned that you can have a 4.0 520 MCAT and still not get in. I think that's really honest. I had a fairly high MCAT and GPA, but I went to Ole Miss. So I'm like, okay, I'm going to a smaller school, and there are these people who are like from Hopkins, from Harvard, from this place, from that place. But we were in the same interview, which means at that point, we are level. And I think one of the big advantages I had was that I was actually able to speak to my interviewers as if we were having a conversation. And some of that I really had to develop over a few years, which, funny enough, I did that by becoming a waiter, because I started out college as a really big introvert. I was like, this is not good if I want to be able to talk to patients or just talk to people in general. So I became a waiter, and the skills I picked up as a waiter really helped me in my interviews. That and preparing for my interviews, like thinking, okay, they're probably going to ask me this, maybe this, and like at least thinking about those answers and having well thought out answers for my interviews. I might have missed a few steps, but in general, I spent every summer my undergrad doing research in some capacity, either at my own university or either at the Medical School of Mississippi or at WashU. I did an undergrad thesis, and then I tried to do as much volunteer work as I could, both clinical and non-clinical. And then there were just things I did for fun to keep myself sane. For me, that was baking. And that was something that also went into my application. That way it wasn't, oh, I'm just pre-med, but I was able to show I'm a whole person because I had other things to complement all the pre-med stuff.
Awesome, thank you. Anirudh, do you want to talk a little bit about like the dental admissions process and how it might look any different?
Yeah, sure. Yeah. So the dental admissions process is, I guess, slightly different. I mean, the timeline wise, pretty much like about the same, but instead of the MCAT, there's the DAT or the DAT. And you can take that basically. I took mine like in junior year, but I know people that took it like the summer, like during they were applying, or like even during spring break, but yeah, it's about again like 1 to 3, like usually a lot of people start studying like 3 months before, but when you get to like that 4 to 6 week mark, it's when you like, it's kind of like when you have to start grinding and like start going in. Like I remember I was like studying like 10-12 hours a day. I mean, I know some people, sometimes you can't, I know some people can't do that, so like it depends like what works for you, but that's why like kind of like keep a schedule for yourself before you take the test, kind of I guess like so you don't like understudy before the test. But yeah, you take the test, and then depending on when, I think the application, I think now it's opening like in late May or early June, something like that. I don't know if there's gonna be any delays like because of COVID or whatnot, but yeah, so like it's sometime around like early June, and then got to send in like your composite letter, your like letter of recs, like PHA, the PHA office will kind of help you out with that too. Like if you, they're really helpful, keeping everyone kind of like, as long as you try also meet with your advisor as well, kind of get to know them, because they're really helpful. But yeah, so we apply early June, and then you get most schools have secondaries, some don't, just depends. But yeah, you'll get secondaries back like whenever you apply. Like I applied like as early as possible because I was nervous because I didn't want to apply it too late because it is rolling. But I mean, but like it's not like, again, like if your like GPA and like your DAT score is high enough, like probably, I mean, honestly, that might not even matter like if you apply later. But yeah, so like if you're, but again, so like so basing, like you'll get your secondaries like 2-3 weeks later, sometimes earlier, like maybe a week later. But so yeah, you'll get it in like June, July, and I think I finished everything like around like late July-ish. Like that was the last one I finished. And then you'll get interviews, and I mean, pretty much after you finish your secondaries, that's when it's like, I guess like the most like, I guess, stressful or annoying, I guess. You're just waiting on like getting an interview, and after that, it's after you get an interview is when you start preparing. And I think once you get the interview, I think for dental school, they like you, so it's pretty much just making sure you're a human. Like they like, you need to like, if you're gonna be a dentist, you're gonna be talking to patients, you have to be kind of like just kind of social, kind of make sure like you're like you got to make sure you're not like kind of like I don't know, like super quiet, or like not make people uncomfortable. So you want to make sure you're doing that during your like make sure you're like normal, and like not like want to like be talkative to your interviewer, like ask questions about school, things like that. And yeah, I mean, after that, I mean, I think for me, like what I would do like to like not stress out about like whenever like I was worried about like getting accepted or not, I was working out, I was just talking, for like hanging out with friends, kind of like keep yourself distracted, not really, I don't really like try thinking about stuff, but I mean, just do things like that. I mean, that's pretty much it. I mean, you find out pretty much when you're accepted, I think basically anytime between December to like basically sometime in the summer. So it just depends on like the school you're applying to, the schools you applied to, and yeah, that's pretty much it. But yeah.
Okay, awesome, thank you. Okay, so the next question we have is just like, what are some challenges you face in your journey? What do you think is the most difficult part of being in whatever school you are in as a student? Anyone can answer.
I can talk about this. So I am in my last year of medical school, so there have been a lot of challenges along the way. So I do want to emphasize to all the students in this call or this meeting that, this make sure that this profession, whatever you pick, this is something that you really want to do. If you're in it for job stability, for money, I'm sure you've gotten this talk, but I want to re-emphasize it from the position of an MS4 is that you can make a lot of money outside of medical school, outside of being in a healthcare profession. It's just the type of job is different. And a lot of my friends who graduated 4 years ago and took business jobs or took comp sci jobs make a lot more money than I do currently. I make zero. So I think I just really want to emphasize that out there because I feel like every year of medical school, there was a new challenge and it was hard every month. So first year of medical school is a lot for me and our curriculum. The first 1.5 years is didactics, and those lectures are hard. I think that I was a pretty intelligent person in college, didn't really struggle that much. And then I came to medical school and it was challenging. Because of the nature of our curriculum, we took 4 med school classes at once. We had anatomy lab. We had to juggle all of that. And so it was really, even though it was PassFail, I think it really weighs you down when you work so hard, but don't make the grades that you want to. And I'm sure a lot of medical students and college students can resonate with that. And when you see all of your other friends in medical school and not in medical school succeeding and doing well, it really does put a damper on things. And you're like, I got into this field because I wanted to help people, and yet I can't even get to that stage. And then you're like, everybody tells you it gets easier. I feel like it gets easier in different ways. There's still challenges. So second, third, and fourth year, when I'm in the hospital, it's like every month you're on a different service. So every month there are new challenges and having to acclimate to that. As a medical student, you are on the bottom of the totem pole. So even though the culture of healthcare profession should be a safe learning environment, sometimes you will meet people who don't make it that. And sometimes you may be humiliated. Sometimes you may feel like you're being scolded like you're a 5-year-old child. And sometimes it just gets really difficult. And you have all this academic burden, but also this mental and emotional burden of trying to do well and succeed. And sometimes your efforts may not result in what you define as success. So I think, at least for me, it was really important in those moments to remind me, well, first of all, take good care of my mental health. Second of all, just reminding myself why I went into medicine. And I think that's really what's helped me pull through. Public transportation may go by, you may hear it, but being at a county hospital where I get to work with patients of all types of different backgrounds, speak all types of different languages, and require me to use an interpreter to communicate with them. I think at the end of the day, when I walk away from the hospital, no matter how difficult my attending may have been or how difficult the residents may have been, I think gives me a sense of wow, good job, Jennifer. You did good work today, no matter what you get on this exam. But that being said, prepare yourselves. There are exams after exams after exams, lots of board exams, lots of just regular old exams.
I'll go next. So I think I'll divide it as challenges through undergrad and then current challenges for med/PhD. Challenges for undergrad is I did not really have a mentor as far as someone say, oh, this is how you do this is how you do that. So a lot of it was really me just kind of Googling and hoping that what I was reading was correct. And then Ole Miss does have a health professionals office, but it wasn't necessarily the best. We didn't really have it any senior students that could help junior students too much. But that has changed. One of the things that I did before I left Ole Miss was to really help pump up the office. So now hopefully they still have that pathway for mentors. And then being in Mississippi, the real being real for a moment, being Mississippi as a Black male, that has its own challenges where like, oh, I'm pre-med, and people are like, oh, yeah, you'll get in because of blah, blah, blah. I'm like, okay, so no matter how good my scores are, that's kind of all they see. And that can be a little bit just, it can have its toll on you, but whatever. As far as medical school and PhD, I actually learned while I was in medical school and still learning this now is that the way that I learn material is very different from how I guess should be learning. And I really need to invest in like finding strategies to help me learn better, because throughout my life, I've just stuck with these basic strategies I have since high school, and they've basically worked. And now in medical school and PhD, that's different. And now it's a challenge. And one final challenge is to switch from medical school thinking where it's this is the answer, memorize it, don't really ask why, which I really don't like, to now switching to PhD where literally every step of the way is why this, why that? Okay, you did this kind of test or your code like this. Why is that? What's the rationale? Go deeper, go deeper. Whereas med school is like, here are all these pathways and know what they do and know these key facts, but don't worry about going 5 hours learning about why is it this enzyme versus this enzyme. So those have been my challenges.
I can go next. So some of the like challenges that I faced, and it's weird thinking that in 2021 I'm still feeling this a little bit. So osteopathic medicine has a small stigma, very, very small stigma. It's something that some of our professors are starting to talk to us about as we're thinking, I'm in my third year. I'm starting to think about residency. And yes, there was a merger a few years ago between like the AMA and the AOA, which are like the two governing bodies that I think talk about residency. I'm sorry if I'm saying any of this wrong. Logistics confuse me. But now it's all one. But there are still programs that literally will not look at me because I'm a DO student. And that's something that's still there. And there's like kind of a joke that one of my professors told me last spring that was, the difference between you getting looked at for a residency program and you not may just be a well-placed retirement. And that's frustrating sometimes. Yes, whoever just said imposter syndrome, I also agree with that. Whole sidetrack. Yes, that happens a lot. A lot of my friends, I think almost every single one of my friends has gone through that at some point or another. You really start questioning yourself and you start looking for that one little tiny thing that makes you see straight and makes you believe like, yes, I deserve what I've like the amount of work that I have put in is what brought me here. It's not just luck, even though it's hard sometimes to feel that way. Another challenge like being an osteopathic student is some people just don't believe in osteopathic medicine. Some of it, I will be honest, is a little bit hard until you felt it and then it's like you can't unsee it anymore. Like I can tell you that there are osteopathic techniques literally talking about how the bones in your skull move. And it's so hard to believe. I myself had a hard time believing it until I was sitting there and I felt the bones in my skull actually move as I was breathing. But I definitely have had some people sit there and ask me straight up, this was last spring, someone who's in medical school too, like, oh, is that actually proven stuff or is this just like voodoo medicine? And that's hard to believe. Like to me, yes, I 100% believe it. I will stand for it. Like I will fight you on it. But I think until that's just something where you have to be very confident with yourself. And so part of the challenges of being a DO student, at the end of the day, it's cool. I mean, you learn a lot of things, you get to help. And I think that's kind of what gets me through it is just the little ways that I can help someone and know like, okay, even if person A doesn't believe this, person B is going to get so much benefit out of it. And I think that definitely is hard. And I think it really just tests your mental strength. But yes.
So, thank you. If no one else wants to share, we can keep going. So next question is, what factors should students consider when they're applying to and eventually selecting a school? What did you all look for in schools when you were applying, and what do you wish you looked for?
For me, the biggest thing was money. If Big draw of the MD PhD program is that it's fully funded. If I had to actually pay for medical school, I know you get a physician pay afterwards. That was not really going to be an option for me. The second thing was probably location. I love my family very much, but I am from New Orleans. I went to Mississippi to be away from my family, and I did not apply to any schools in Louisiana because I did not want to deal with the stress of medical school and family. And then there are just some other places I was like, I do not want to be in Alaska. I'm not going there. I do not want to be in New York. I'm not going there. I applied to a few places in California, and during the interview, I was like, I don't like California. Well, Southern California. Cross them off the list. And so that was probably the first two things, like cost and the location. And then actually looking at the program I wanted to do, I knew I wanted to do an MD PhD in biomedical engineering. And I wanted a place that also had a PhD in neuroscience because the work I focus on now is more neural engineering. So they had to have that. And then cost of living was a bit of a thing, but also just like other things like, do they have a school of public health? Because I might be interested in like collaborating with people with that. Do they have this kind of program, this kind of program? It's really more program heavy. And then I looked at what were like their averages, plus or minus standard deviations for like the MCAT, for their GPA, because I did not want to waste money on a place where I probably wouldn't get in. For the Texas schools, I used what's called the MSAR. I think it's still a thing. And I realized there's a very high ratio of Texas residents to not Texas Texas residents, not Texas residents. And it's a separate application to apply to Texas schools except for Baylor. So I decided it wasn't going to be worth my effort to do a second application when I'm not a Texas resident. That was my personal choice. Other people will say something else. I'm sure you'll hear that in a few minutes. So I basically took like all the MD PhD schools, cut out from location. If it wasn't the right location, took them out. If it wasn't the right programs, took them out. If it was some other factor that I felt I wouldn't be a good fit or I wouldn't like it there because this is a very long program. I'll be here for 9 years. And that's kind of how I selected my schools for my application. I sent out my primary application, and then some of those schools sent me their secondary, and then we went from there.
Yeah, I'd like to echo a lot of the logistics of that. I think that the strategy is obviously, very systematic in that way. Some of the things that I would add, something that I really looked for in a medical school is how soon you start to get hands-on experience. I wanted somewhere where I could start as soon as my first year being in student-run clinics, and that was something I really liked about my school. Then kind of for the curricular aspects, one, it's really important to understand if you're going into a school that's graded or pass-fail. I think that I'm in a pass-fail curriculum for the first 2 years, and it really helps you adjust to medical school. And it was something that kind of helped with our class's wellness. So I appreciated that. Another thing that medical school curriculums have is a traditional curriculum versus systems-based. Essentially, all that means is there's two different methods of learning the material. One, in which you go through all of the normal physiology during your first year, and then in the second year, you go through all the pathology, versus a systems-based where you go by system, for example, cardiovascular unit followed by a GI unit, so on and so forth, learning both the normal physiology and the pathology all in one. Something else that I would encourage students to look at is the length of the third and fourth year. For example, the curriculum that I was in, I did not get any electives during my third year of medical school, but I have an extended fourth year where I get a lot of extra time to partake in research and do extra electives and things like that. And that wasn't something I thought about when applying, but I see the benefits of having a long fourth year now, and that's something I'm really excited about. A couple other things, research, if that's really important to you as an MD student, definitely take into consideration the amount of support that you'll have at whatever school you pick. And then something that I really advocate for, again, is regional campuses. At the Medical College of Georgia, You have the opportunity to go across the state for your third and fourth year, whether you'd like to be based in a different city for those 2 years or whether you would like to change sites every 6 weeks. That is up to you, and you have the option to apply for that during your third year of medical school. And I think that there's a lot to be learned from being in both an academic hospital as well as community-based hospitals, and having regional campuses, you get the best of both worlds. So some of those were things that I didn't really consider when applying, and some of them are just things that I appreciate now. And the last thing I'll leave is consider whether you want to be in a collaborative or a competitive environment. I think that it's really important to understand the classmates that you're going to be around, because they're going to be family for the next 4 years. So be sure to think about that too.
Yeah, I want to echo what Amanda said about pass-fail versus graded in the first few years. I'm at a graded school, and I did not realize how hard that is on my mental health. And I really wish I had put more weight on the idea of a graded versus a pass-fail school. Now, like for me personally, the options that I had, all of them were graded. So I was kind of screwed either way. But had I really thought about that, like I actually think I might have thought, like, I don't know, just put more than like the 5 seconds I did into that thought. The other thing is, and it's hard with COVID, one of the reasons why I picked VCOM over the other school that I'd gotten into was the fact that in our curriculum, each of our, we're systems based, and it's 12 weeks each. The last week, if you're passing in all your classes, you get that week off. So you can literally do whatever you want to for that week, the first year. And the second year, VCOM actually has 3 rural clinics, and I think Honduras, El Salvador, and the Dominican Republic. And so VCOM will literally, it's like a school class field trip of like 20 to 30 kids, students with your VCOM professors, like professors that teach us in Auburn, will go to this clinic and basically like do community service. And we have this clinic there, and it's great. I mean, they've lined it up so that now we have 4 campuses across VCOM. So once a week, ideally, in theory, if their COVID restrictions were different, we would be able to go and just have VCOM students there every single day. And for me, that was like a huge factor in picking VCOM. Was like, sorry, I have a little kid outside. Was like, basically it was that. I mean, I wanted to go and I wanted to do international community outreach, and this school gave me the option to do that in third and fourth year. If I wanted to, I could go back for a month. And not having that definitely sucks. But I will say, like, something that I would consider anyone who was applying to VCOM is ask, with COVID going on, like, how is international outreach happening? Is it happening? I mean, some schools I have heard are doing it. And so definitely some things to consider if that's something that's important to you.
Yeah. Oh,
Sorry, you want to go? I just have a few other things, at least like now that I'm applying to residencies, things that I wish I had like known about medical schools when I applied, and things that people may not necessarily publicize to you. So the first thing, well, first of all, for applying, I just have this saying, like, beggars can't be choosers. That's what I'm telling myself during the residency application process as well. But even for medical schools, like, make sure that you have a good mix of safeties, reach, and fits. Like, don't overestimate yourself. I think that's really important. And be willing to go to regions that you wouldn't like necessarily consider if it means that it's a safety. But also remember, keep wellness in mind as well. You don't want to go somewhere you really truly wouldn't be happy. And in terms of selecting, I think really important questions that they probably don't address, but that you could ask and sound like an all-star are board exam first pass rates. So now for medical school, I believe step 1 is pass fail. So this may not matter as much, or we may see it change, but I think it's really important, this concept of first pass. In medical school, if you fail your step 1, or if you fail your board exams even once, like there's really, I mean, there is a second chance, but it can really harm your chances into getting into residency. So I think it's really important that you know that this school that you're going to supports the students academically to make sure those first pass rates are very, very high, and that there are certain like tools in place to help students succeed. And then this was more for step 1 when it was graded, but like average step scores, because it'll surprise you that some of the like top ranked medical programs in the country will have like the same step scores as some of the like lower ranked medical programs, but that's simply because there's a difference in support. That being said, if you're at Harvard Medical School, the students all may be smart, so all those step scores may be skewed, but just things to keep in mind. The other thing is, I don't know if this is a Texas thing or like if it's true anywhere else in the country, but there's like this thing like true PassFail versus fake PassFail, and nobody told me this until I started interviewing. And true PassFail is everything you take is PassFail, like it's what its namesake is. Fake PassFail is where certain schools will say that they're PassFail, but they do grade you and they do like pass, high pass, like I don't know, fail and honors your pre-clerkship year. So in essence, it's like an ABCD system, but they just changed all the names up. And then also something to keep in mind is that I think very rarely are med schools like true pass fail from year 1 to year 4. So I am at a true pass fail for my pre-clerkship. So my didactic years for the first 1.5 years was true pass fail. But now that I'm in my clinical rotations, everything's graded. My electives are pass fail, but my like core clerkships are graded. And that can be beneficial just because when you're applying to residencies, they do actually look at like like your rank and like what quartiles you're in. So it can matter. It's up to you if you want to be in a stress-free environment, or like it goes both ways. It's very 50-50. And then the last thing is, once you've gotten into all these wonderful programs, I think prestige is also something that is worth considering. I know a lot of people tell you, oh, prestige doesn't matter, rank doesn't matter. But being on this side of the residency application process, I do want to say that prestige does have some sort of weight, just like in terms of like what you want to go into. Like if you're considering neurosurgery, plastic surgery, orthopedic surgery, like some of the most competitive specialties in the world, I think prestige is something that you should probably weigh a little bit higher. The other thing with prestige is that it has, your school will have a lot of connections. And so if something happens during the residency application process where you don't match into residency, your school can pull the strings to get you somewhere if your school has that prestige. So things to keep in mind. I think a few people have asked me about Texas application process, and I know that one of the panelists mentioned it. Texas has a law where we have to take 90% in-state residents. So only 10% of every class can be out of state. So that is the ratio that I think it was Sherman who was talking about that. That is the ratio. I still want to say that it may be worth considering because our tuition is unparalleled. You'll never get tuition like we do here. And if you're an out-of-state student, they will provide scholarships so that you can pay in-state tuition, which comes out to about like $19,000 per year. So and our cost of living is phenomenal. So like counter that with living in the Northeast and having to like pay that much tuition. So just a little plug for Texas in there.
Yeah, I want to just follow up on some of the things that they said real quick. Like Jennifer said, you know, I think it's super important to know, like not to know, because I think I really don't know what I want to do in medicine, but I know I came into medical school thinking I want to do some sort of rural underserved primary care. And in the state of Tennessee, OBGYN is considered primary care, and that's what I'm most interested in. So I was really looking at a school that focused on primary care and underserved communities. And that was what I really wanted. And so I think it's important to, like, if you are somebody who knows what you want to do, like you feel it in your spirit and you are set on a specialty, I would recommend when you're looking at schools, look at how many, like the student body and how many people go into the specialty you're most interested in, and where they're matching, and see if that aligns with your goals. To regress, also, there are over half of my classmates who still have no idea what they want to do, and that's completely fine if that's you also. You know, as an MD/MPH candidate, and I'm sure with MD/MBA, some of the other programs, you've got to look at, you know, what those programs offer at those schools if you're interested in that. I think with MD/PhD, Sherman, you can tell me if I'm wrong, but I think you apply to that as one whole program. the whole dual program, but like with MD, MPH, I know you applied to just the MD program and you can add on an MPH later on. So that's something you want to consider if you're competitive for certain programs that are completely dual, or if you're adding it on later. Sherman, were you going to say something?
Yeah, I was just going to say that for the MD PhD program, you typically apply to it as one program. So you'll do MCAS, the med school application, and you'll select MD PhD. But for a lot of schools, you can actually apply internally. So after your second or third year of medical school, you can apply to the MD PhD program.
Yeah. Another thing that I really wanted when I was looking at schools, I wanted a smaller class size. Like I knew I did not want a 200 plus person class. That is not somewhere I thrive. That is not an environment for me. And so my class is 72 people. And I love it. And we all know each other really well. And it's really conducive to my type of learning. And I think that's something that you might want to consider when you're applying to medical school. Another thing that I think is super important is your interview day. I know I said that earlier, but I think when you're interviewing, it's really important to look at it as, you don't need to be worried so much about, do they like me? Be your authentic self. And if it's meant to be at that school, it'll be meant to be, but you also have to really like that school, and you have to see if it's a good fit for you. You have to talk to administrators, talk to admissions people, talk to students on your tours. And you have to really think can I be with these people for 4 years? Even if you interview at, Harvard Med and they love you and they want you, you've got to be like, would I be happy here for 4 years? If you interview at the smallest school in the country, you've got to be like, would I be happy here for 4 years? And that's different for everybody. And one other thing I want to say is student population was really big for me, and kind of organizations that they offer. So our school has an SNMA program, which is for basically minority students in healthcare, and it's representative of them. And I think that's something that I really cherished in my medical education, and diversity is really important to me. And you kind of want a school that supports that and supports your interests even outside of medicine. So I think those are all really important to look at also.
I will echo what Alex said about it being a right fit. I actually did interview at Harvard, and I realized from my interview, I didn't want to be there. So I literally told my interviewer, I don't want to be here. And then they rejected me. But I realized I don't want to spend 8 years in Boston where I would have to sell my car and everything is more expensive. And I just did not feel like I fit into that kind of environment.
I just want to add one point. Everyone's had wonderful points, and I think I really do agree with all of them. I think looking back on my application process, rather than the actual med school choosing, I wanted to talk about how many to apply to. So when I was applying, I think what was really beneficial for me is I applied to a good number of programs, but I also did enough where I knew I could make each one unique. And so my friend and I were talking a little about her process versus mine. She also graduated from Emory. She did do a lot of copy pasting and going in and editing a few parts, whereas I wrote every single one from scratch, other than the diversity statement. Obviously, I think you can move that one around a little bit, but I think just applying to as many schools as possible actually hurts you in the end. And I don't think that's emphasized early on, especially people, it's getting more competitive, and our go-to is to be let me just apply to 50 schools. And the same thing happens with residency. My fiance is applying for fellowship, and everybody applied to every school, and now it's hurting all of them because they have too many people and too many, so I think that choosing based on what everybody else has said on what schools you already think are in your area that you think you would actually be happy at and go to, and not far away from your family or close to your family, and then really honing in on making those applications quality. And it sounds basic, but I already had dark eye circles from staying up nights writing my applications, and I highly recommend keeping it to a minimum where you feel you're giving your best to the schools, and that they can really see you and who you are through that writing instead of copy pasting. So yeah, that's my big piece of advice with the application process.
Yeah, and I know I keep talking, but I was just gonna follow up on that real quick because I was gonna say it earlier. I think Sonam is completely spot on. I only ended up doing 13 school applications overall, and I think one thing about being at Emory is I had so many friends who did 40 plus schools. And I think mentally it wears on you when and inevitably you will a majority of the people who do 40 plus schools will get 30 plus rejections. And that's just like how it will go. And I really think there's so much to be said for literally looking at schools and only applying to places that you really would say, I would absolutely go here if it was the only school I got into. And if you wouldn't, then you might want to reevaluate why you would be applying in the first place.
Another question that a lot of students were curious about was the financials of medical school and financial aid and how all of that worked out. I know it was kind of briefly mentioned in this question as well, but if anybody would like to address that specifically, that would be super helpful.
Apply MD, PhD, fully covered.
If you don't want to do research, you don't have to apply MD, PhD. There are still scholarships out there. Surprisingly, they are very few. And once you get into a medical school, there may be more scholarship opportunities available to you. But actually, I don't pay anything for medical school, even though my medical school is also dirt cheap compared to like all the other medical schools in the country. And there's quite a few of us over here at UT Southwestern who have that opportunity. So that is something that I'm really grateful for. But that being said, another plug for Texas, I guess, and for some of those places with affordable cost of living is that I think that is something like pretty reasonable to consider, is that living in a place where when you take out loans, you can like actually spend them on things and that like that matter to you versus like taking out loans for things that are just like really expensive for no reason. I won't name any regions in the country that are really expensive, but in Texas, you can afford to live. Like I know a lot of MD, PhD students here who actually ended up using their stipend money to invest in condos and townhomes before COVID happened. And now they have the extra Texas boost, but they also have the extra COVID home rush boost. And so they actually are making they made a huge profit. So I think finances, I got really long-winded, sorry, but finances wise, like there are scholarship opportunities available in medical school outside of MD, PhD programs. And then also it's mostly just loans if you don't have that, or family if you don't have a family who can also support you financially, which there's a lot.
For dental school, there's, I mean, I go to Columbia, so it's in New York City, so kind of the polar opposite of Texas, I guess, in terms of cost. But I mean, it's dental school is more expensive than even med school. Like we take classes with the med school, so like they tell us like we know how much they pay and like how much the difference is. It's a lot more. Unfortunately, there's not like really a ton of scholarships either. It's all, I mean, like either you're lucky you have a nice family that you get that can afford to pay for it, or like me, you're on loans. Like I mean, so like I mean, at the end of the day, I mean, most of us are on loan, so we're all kind of in this together, I guess. We kind of wait and think about it. And I mean, if you don't, I mean, that's why you got to really like it. If you're going into this profession, if you want to be a dentist or, I mean, even a doctor, you're gonna have lots of loans if you, depending on where you are. But I mean, yeah, you're gonna have. I mean, for me, it's a lot of loans.
I wanted to touch on something that I'm personally like also really passionate about is I think that a lot of students go into medicine with this like empathy and like, not saying that it goes away, but like I feel like you're like, oh, I want to help people. And then like as you get burnt out, you're like, okay, I'm going to go into the highest paying fields I can pay off my loans. Which I think those fields are important. Like, you know, my mom needed a dermatologist last week, and like I'm thankful for dermatologists and plastic surgeons and all that. But I think that like as you go through med school, also reminding yourself why you're there, and that if you did come in with an interest in rural medicine, that you can pay off your loans. And med schools do work with you to create financial plans that like shouldn't push you away from a field just because you're afraid that you can't pay them off. Now that I'm entering clinicals and I had like 2 years of loans, and my fiance is all the way gone through med school, like we probably will have over 400K in loans. But I think that like sitting down and like really figuring out a plan like we have, like it's really not that bad. And I think it's doable. And so my advice is just to like stick to what your heart like goes towards in medicine, and don't just change it, because it's like multiple years down the road, I think you're going to reflect on like why you're in a field that maybe doesn't get you out of bed every morning. Yeah, so that's kind of like, I'll get off my soapbox here, but like I definitely think that it's great to have passionate doctors, and I hate to see people kind of swerve from what they want to do just because of finances.
Yeah, I think, I think some people have said they pay nothing. Some people have said they pay everything. And then like there's the in between, like you take out loans, but you might get a scholarship that covers some of it. It might cover your housing, or it might cover your tuition, but you still have to pay housing. I took out loans for my first 2 years, and I also have scholarships that cover some of my schooling. And it's just different for everybody. I will say that like my school has a separate scholarship application that you have to do yearly. So just be on top of those deadlines at your school, because there's people who didn't get a scholarship their first year, but then they did their second year, or you cannot get your first year, you can get one your third year, fourth year. Also, there's external scholarships that you can like just get on Google and be like medical school scholarships for the state you're in, and like your state might have specific scholarships funding through like the federal, like through state government or whatnot. I know Tennessee has that. Someone mentioned like in rural medicine. I know depending on what type of medicine you want to go into, there's certain programs you can do in residency that will pay off your loans entirely. If you go work in a rural or underserved area, if that's what you're interested in. There are like plenty of opportunities to not be worried about the financial burdens of medical school. And like someone else said, 95% of the people in medical school are on some sort of loan, I feel like. Maybe not that much, but there are a lot of people who are on loans in medical school, and that's just part of it. But the payoff is worth it. And no matter what specialty you go into, you will be able to pay off those loans.
Okay, awesome.
Don't brag on rural medicine. At least in Texas, they make a lot. I've seen lots of rural med people make a lot of money. But that being said, like Sonam was saying, please don't make money the reason why you pick a specialty. Again, like we've all been talking about how like life is difficult in med school, but it gets like even more difficult in like residency, and like even in like as a physician. So make sure you're picking a specialty that you love.
Yeah, and one last thing is just like the same thing we've been saying, don't go into something for the money, but at the same time, like I'm interested in rural medicine, but don't go into rural medicine just to get your loans paid off, because you'll be miserable and you won't be doing it for the right reasons.
These are great points. Thank you. Okay, we're gonna move on to the next question. Just like briefly, kind of what is helping you get through your like med school or whatever school you're in, and what's helping you stay healthy, both physically and mentally?
I'll start off. This is actually a really great question, because I feel like in the medical program, we do not talk about mental health enough, even though we're the people that give people mental health or help people with their mental health. I literally this year started seeing a therapist. First, I had a psychiatrist when I started med school, and now I have a therapist. And I'm saying that to put it on, like, just to say it. I forget the exact statistics, and you can look it up if you want to scare yourself. But substance abuse problems in people in like the healthcare field is higher than the general population. And there's a lot of, I forget the word for it because I can't think about the word, but there's just a lot of like badness about talking about like mental health, or like you're not doing well. And we always say, oh, you need this work-life balance, but we don't really talk about how to achieve that. But for me, I have a psychiatrist, I have a therapist, and most importantly, I have my friends and my family that I literally talk to, and I have to exercise, or I have to do like something outside of medicine to keep myself sane. So that was very discombobulated, but do not be afraid to seek out professional help for your mental health, and do not feel like you are alone in maybe having stresses to your mental health, because not only are you not alone, it's actually a really big problem in the medical field that we do need to be cognizant of and actually address.
I want to like echo that too, especially with like therapy. There are so many ways to see a therapist. My personal one is costing me an arm and a leg because I wanted something that was more like I wanted to see someone who was more convenient. And so I found like an app and it makes just my therapist very accessible and very helpful just because I mean, the things I see in the hospital sometimes, I mean, they're hard. And sometimes you need someone to process it with that day as opposed to having to wait. And so for me, oh no, I'm using BetterHelp. Is that what you were asking, Sherman? Yeah, BetterHelp. Highly recommend it. My school actually even offers like a discount, thank God. But it is helpful. It does cost a lot, but it is worth it in the end because I think when I wasn't seeing someone, my mental health, oh, it was bad. And having a friend group and just finding ways, my friends and I all realize that we are terrible at getting ourselves to go and exercise. And so we would just literally go on walks together. VCOM had like a really pretty pond in kind of our backyard behind the parking lot. And so we would literally just go walk around the pond for a little bit, watch TV together, literally sit in the cafeteria. I think we were watching Bachelorette once, just to like do something to get your mind off of things. It's really easy to get in this mindset of, oh, I can't go do that because I have to study. I definitely did that where, especially during COVID too, where I just started like not exercising, not eating right, not doing this, not doing that, not sleeping, just because I kept telling myself like, oh, I have to study, oh, I have to study, oh, I have to study. And I found that I suffered mentally and through my grades too. I wasn't doing my best. And I think admitting that is really hard. And once you start talking about it, you realize like a lot of people are going through it. So definitely don't be afraid to talk about it. And if you ever need someone to reach out to me, always welcome to reach out to me. I'm happy to listen.
Yeah, definitely the whole support system thing is super important. And then I'll just add super quick, it's important to continue hobbies that you had like during undergrad or, during your gap year. Just making time throughout your week to do something that you really enjoyed like prior to medical school. So for example, I was a music major. Unfortunately, I played piano, which is a really inconvenient instrument to like if you're like living in an apartment in medical school. But I found somewhere to go volunteer and like play the piano. And that was kind of my outlet for a little while. And like we have an intramural soccer team, and that was really important to me for with my physical health. And then also just kind of like getting together with classmates. So find ways to continue your hobbies too.
Oh, sorry, go ahead. You want to move on? We can move on.
You can go ahead.
Okay, I'll be super brief. So I think the like this is actually very relevant to me because just last week I felt like I couldn't recognize myself because I was like sitting at my computer and couldn't get myself to study. And as a neuroscience major at Emory, like I saw the sunrise from the library like multiple nights, mainly because of like my thesis and stuff. But I was like really like I just never burnt out in college. And now I'm like hitting the point where like I really have to push myself. I'm up to like 3 cups of coffee a day, and like that like it's just like very hard to see like where I started to where I am now in med school. And I think like one of the main things everyone touched on, which like also thank you for being honest, because I think it takes med students like some time to be honest about like substance abuse and like therapy. And like only now is my class opening up now that COVID's over, and like people are like, oh, I should like probably cut back on alcohol, and like it's a thing because you're like trying to find like a like release. And so starting these habits early and like connecting with your like going back and thinking about what you did for fun and making sure you don't lose that is like so important. Oh, sorry, COVID's not over. As in we're an in-person class. Good point. So yeah, I think that like it's just very important, and recognizing when you're burnt and picking yourself up to really take a break and not get a 90 on every test. That's the plus of PassFail, is you just need the P. So yeah, that's my point on that.
Yeah, thank you. No, this is a really important question. Today in class, we had a researcher come and talk to us about how a lot of medical students, like their empathy, however they like measured it, then it like drops in the 3rd year of medical school, and like it's depression and suicide is really prevalent among medical students and physicians. So I hope the conversation and the stigma changes, but we're gonna move on to the last question and finish up because we're getting near 7 p.m. But just like if you could give your undergrad self like a quick piece of advice, like what would you tell them, especially those that might be interested in whatever program that you're in? Amanda?
Sure. So I would say everything happens for a reason, and it's very easy to get stressed, and especially with the minor details. But at the end of the day, everything kind of falls into place for a reason. I think some advice I would give to someone interested in pursuing the same degree as me. I would say don't get lost in the reason that you wanted to do medicine. Kind of going back to that idea of empathy. A lot of the reason third-year medical students lose empathy is kind of as a defense mechanism. You're going through a lot, you're seeing a lot, but don't forget that the people on the other side of like the bed or the office are people too. And kind of treat them like you would want to treat your family members, right? Like if that was your grandma, if it was your mom who was, the patient, I would say like try not to lose your empathy and don't lose sight of why you want to do medicine.
I can build off my past point. Don't burn yourself out in undergrad like I did. It's very easy in pre-health majors. I think someone touched on this earlier at Emory. Love the school, and I didn't really see as much competition. I think everybody has a different experience, but you still feel like, wow, there's such a big pre-med community. And I wish there was like a better mentorship program, because like I would love to like, talk to pre-health students and tell them like how I would change myself in the past. And like, please reach out if you ever want to like learn more about my reflections lately. But I think that like I overworked myself, and I was just telling an Emory student reached out to me last week, and I told her like I did an honors thesis my senior year, which I loved, but I also think like I had less free time. And so that's what pushed me to really enjoy my gap years. And so it's important to work hard, but also find that balance. So like if your fourth year is stressful, then like take a year for yourself and like balance it out before you go straight into med school. Like I think that's going to be really harmful for you. And also just like I like literally passed out during a physics exam because I like didn't eat and take care of myself. So I think that like also just like keeping up those habits in undergrad and practicing them before you get to med school and things get tougher, because like Jennifer said, like people keep telling you it gets easier, like med school is hard, but then they're like, oh, one day it'll be easier. And like I don't necessarily think that it does, especially seeing my fiance almost be done with residency. So I think that like I'm so passionate about like student wellness and like finding things that maybe you've also never done before, because that can also be like a creative outlook. Like I started getting back into salsa, and it's been years, but it's nice to like have that break. So yes, that's what I would say to my undergrad self is find that balance early on so that you build those habits and med school doesn't come like slap you in the face in that sense.
For me, I would say this is actually something I should have done. Well, advice I would give myself if I could redo things is I would actually have taken a gap year between like graduating college and starting medical school. Some really big family things happened, like literally 2 weeks before classes started. And really, I should have just taken a gap year. And then during the gap year, I could have learned, like I used to, when I was a waiter at a Thai place. And I kind of went back to the Thai place and like learned how to make delicious Thai food, or just done things more fun, like completely de-stress after undergrad, and then be able to start med school like fresh and ready to learn, like really eager to learn. And then also to stay with my good habits, I used to run a lot. I used to be able to say, oh, I'm stressed out, let me just do a quick 6-mile run. I can barely do a mile now, and I really wish I had kept running and like kept up my good exercise habits. So yeah.
Yeah, kind of real quick. I just think like have fun. Like I know it sounds stupid, and I know you're like, how am I supposed to have fun if I'm applying to medical school and taking the MCAT? But like if your friends tell you they want to go out to eat, like go out to eat. Like if your friends are going to get ice cream, go get ice cream, because while I will be a proponent of saying there is time for that in medical school too, it's just so much less time than you have now. Like you think it's bad now, but it's in medical school, the material is enjoyable and it's cool to be like, I've acquired all this knowledge, but there's just so little time to actually do what you want and have fun. So like right now, if you have that time to do that and go be with friends and go out and do stuff, do it, because that time really disappears quickly.
I'll make mine also very quick. I think I would tell myself to make my research experiences count. I feel like I am not a huge researcher. I don't really like bench research. It would be awful for me to be in a PhD program because I really don't think I like research enough to be in a PhD program. However, research is really important to medicine, and people may tell you that research experiences don't really matter, but I do think that we're seeing a shift where, or it's always been that research does matter, whether it's like clinical research or bench research, but it also does apply to residency as well. Like when you're applying to residency, it's important. So to my undergrad self that went around like trying like lab hunting and like lab hopping, trying to find like a research experience that I actually liked, I think for me, I would tell myself that like every research experience counts and don't burn those bridges. So like with those like lab PIs or the people that I did posters with or present, I didn't have any publications, but for everybody else who did have publications or went to conferences, like don't forget about those connections when you come to medical school, because those connections can be helpful to you in the future. And if you have publications that like some people think, oh, I need a publication before I apply to medical school, and if I don't get it before medical school, then it doesn't matter, so whatever. But I have a lot of friends here who worked on those projects until the last minute, and they published 2 years into medical school. Like they like forgot about it, but they put so much work in that their PI remembered them and like included them in the authorship and presented that poster actually as a 4th year medical student at a conference recently. So it's like those research experiences do matter if you can make them matter. But also again, like the whole theme is like don't stress yourself out. I'm not sure if my undergrad self would have been able to do that, but it is something that I would like people to be aware of.
I'll add like one. Oh, sorry, someone else supposed to go.
Oh, no, you can go.
Okay.
Oh, go ahead. Can I add something real quick? I did clinical research just off of Jennifer's point at a play with a mentor I really liked, and I think she is looking for students. So if you are a neuroscience major and you're like an MS1 or MS2 and you're looking for research, feel free to email me.
I was gonna add one point. What was I gonna say? Oh, okay. One thing that I would tell myself, it kind of goes along with mental health a little bit, kind of not, but everyone is gonna do different things. Even, I mean, I'm sure a lot of us were neuroscience majors at Emory, and a lot of us are at different medical schools, and none of us took the same path. I can almost guarantee you that. And I think realizing that and not getting stressed out when your friends are taking different paths than you are or doing different things and getting to similar places is really important, because I definitely was affected and kind of shouldn't have been, where I kept telling myself like, oh, why are my friends doing this and I'm not? And I think that put a lot of internal pressure on myself, and it ended up hurting me in the end. And realizing that, I think will make undergrad a lot more fun too, especially senior year or whenever you are applying. If you decide to take a gap year, I think it'll make the process a little easier and not as tough as it was for me.
I will say this is advice I did actually follow, so I wouldn't be giving myself the same advice, but for everyone else, and this has been hinted at throughout this entire talk, but have friends that are like going through it with you, and then have friends that do something completely different. And I think that holds even during medical school, during graduate school. I have friends, like I have a lot of my lab mates that I also consider my friends. And then there are days where I'm not talking to anyone from my lab because I want to think about something completely different. So having a balance of friends going through it with you and friends not going through it with you is really important.
Okay, I think that's everyone. All right. I have kept you for like an hour and a half, but I really learned a lot today, and I think everyone here really enjoyed it. And we're recording this, and it'll probably benefit like a lot more people. I wish we could like feed you all dinner or something, but we can't. But thank you all so much for coming and sharing your experiences and your advice with us. I hope we can all keep connected, and just I wish you all the best, and I know you all are going to make amazing physicians and dentists and whatever you become to be. But yeah, thank you so much, and this pretty much ends the event. If there's any last words you want to say, go ahead, but yeah, thank you so much. Bye.